What we'll do is we'll assess each of them as they come out. Then we've got 3 vehicles plus us, so we'll take 1.
Yeah.
We've got more monitoring. Do we have a brief for the doctor, Simon? Okay, that's fine.
In a multi-casualty incident, the main role of the doctor is triage, really, to decide which patients need treatment now. Okay, so I'm looking, if you look to take her on your vehicle then, that'll be fine. I'll assess the others as they come out. How do your teeth feel? If you run your tongue over your teeth, do anything feel sharp at all? No, okay. And just open your eyes for me, just have a look at your pupils there. Okay, that's good. You're going to grab a line on...
I'll stick a line in there, and then we can move on.
Yeah, and I'll assess them with the others too as they come out. Right, yeah, equal air entry on both sides, so I'm happy for you to take her by road. So far we've got, that's really mechanism only on there. Yeah. This one we've got query pelvis, query hip and a facial injury.
Right. You might feel your head go a bit swimmy, but that's fine, all right?
Of the 3 people that were there, Mum was the most serious. The pelvic fracture particularly can cause a lot of really quite catastrophic, life-threatening internal bleeding. I waited until the dad came out before we made the final decision on who to move to hospital first.
Yeah. Yes.
Yeah. You got your tablets?
No.
He was covered in a lot of blood, obviously had a head injury, but he was conscious and moving.
We'll
take him as he is, yeah.
We assessed Mum and her injury pattern, and we realised it would probably be best that she was going to be the one that we were going to treat, and we were going to fly down to the John Radcliffe.
Yes, please, Alf, cheers.
Tiny little job for you. I don't know if you want to. You just get a thumb.
Say again? All right, yes. You just dislocated your thumb on this side. Yeah. What I'm going to do is gently pull on it, and then we'll just pop that back into place. If it's really painful, let me know. There we go. Well, if you use these fingers just to hold that thumb in place, then it won't pop out again. Yeah. The idea is to make sure that everybody's treatment has been started and is going well before I leave the scene with the most critical patient. No, that's good. Thank you very much for your help. That's a good job. Thank you. Cabin doors, harnesses, we are all secure in the back.
By helicopter, Mum June will arrive in just 10 minutes at the major trauma centre at the John Radcliffe Hospital in Oxford. The rest of her family are taken by road.
Really, they were lucky to get out alive. It's possible that Mum was unconscious initially after the impact, and if you're unconscious underwater, then you will drown.
She said they were just coming back from holiday. Just driving back from Luton this morning, so...
Yeah, I think they left the road just before the barrier starts, from the look of it.
Gone through the trees and then...
Yeah.
It must have been pretty scary.
Yeah.
This is June, she's 52 years of age. She was the driver of this car that's left the road, and they've gone about 30 foot down into a river. She's maintained her airway, we've got no ABC problems. Top to toe, she's got an obvious black eye and some blood around her nose. Complaining of pain around her right lower abdomen into her hip. Also, she had a dislocated thumb that Simon popped back in. All right, thank you. Cheers, love.
Durham Tees Valley Airport in Darlington, home to the Great North Air Ambulance. This is HQ, Nerve Centre of Operations.
What do you want, Jean? Do you want a
coffee white one, please.
Coffee white one.
You're a very, very small team, and if you don't get on, it's just a disaster.
What the hell
it's in there.
Is it? I thought you said you want hot water.
Working here is an experience.
This is the doctor's version of a black coffee. What did you want? Was it coffee?
I'll do it myself tonight.
He doesn't even mix the drugs. Do you think we'd trust him with that? No, that's definitely the paramedic's job. So we'll go and see if we can get him to rectify his mistakes so far, and then we'll send him out in a helicopter saving people's lives. Yeah, no worries. Jane will crew request for open lower leg. Yeah, I'll be helimed 6-3.
Yeah, reposition.
Where is it roughly? Boosbeck, Lingdale.
The casualty's injury is so severe that the road ambulance crew have requested helimed 6-3 because they urgently need a trauma doctor.
So just ground taxi now, lift, turn, and hover taxi out to the right. All good in the green.
Hospital trauma consultant and Army medic Dr. Mike Davison works in some of the world's toughest war zones.
Every time I go, I learn new techniques, and we can bring them back to the UK and filter them in. It's one of the reasons now that we're seeing unexpected survivors in the northeast, you know, who are victims of major trauma, and we've not seen that before.
When there's a battle to save a limb, having a specialist trauma doctor on board can make all the difference.
Got a female who's fallen off a horse, sustained a broken leg. Allegedly there's bones poking out of the flesh. The rapid response vehicle. Yeah, roger, seen.
Each member of the team brings a different skill to the party, I suppose, and I guess nobody's really ultimately in charge. Just about the three of us working together.
Happy days, we are there.
I would say we respond to at least 3 or 4 horse riding injuries per week. It can range from serious brain injuries to broken necks, to broken backs, you know, with resulting paralysis, you know, which can affect a patient for the rest of their life. I'm Mike, nice to meet you. I'm one of the doctors. This is Andy, paramedic.
Female jockey Jess has been thrown by her horse and sustained an open fracture to her left leg.
We were just coming up the gallop on the horse, and they were only young horses, and it just had a little play and a buck, and as young horses do, and then a pheasant flew out, and that spooked the horse even more.
It's broken above the ankle, so to the right. But it's broken off, but it might
it's
be.
Also off-ended slightly, hasn't it?
The important thing is not to be distracted by the leg.
Sure you haven't hurt yourself anywhere else?
Is she stable? Is she bleeding into her chest? Is she bleeding into her belly, her pelvis?
A's fine, B's fine, C's fine.
Luckily for her, all them areas were clear, so actually at that point we can concentrate on her leg.
So what exactly, did the horse rear and did you come off?
No, pheasant flew out and it just...
So you went over the top and landed on your foot basically?
Sort of like over the top.
Jay, just to let you know, we'll be taking this girl to James Coop. Yeah, she's got have you seen her leg? She's got an open fracture of her ankle. They're often associated with no blood supply to the foot, okay, so you can lose your foot from that. So at that point, really, it's a case of how do we protect the blood supply of that foot. What we want to do is get the bone back in the skin as quickly as we can.
So we're going to get some fairly strong pain relief, okay? And then we're going to try and get your foot in a bit of a more comfortable position. Okay. Have you ever had anything like ketamine before? Or? Okay. It makes you feel pretty spaced out, pretty strange, okay? One of the things that sets us apart from the road ambulance is by having a specialist trauma doctor. We can provide different interventions and a wider range of specialist drugs.
It may well be that you actually don't remember any of this, okay? This is one of the best painkillers that you'll ever have, so this is really good. This will take away your pain, all right? Ketamine kind of dissociates the brain, so it actually unplugs your sight, your hearing, your pain. So it means that for a limited period of time, maybe for 5 or 6 minutes, I can do something to somebody like try to reduce a broken limb, and it'll not cause them a lot of distress. We'll just totally relax and this drug will work better.
Right, I'll come and do counter tracks.
Yeah, Andy? Yeah. Another 2 of that ketamine.
Another 20.
Yeah.
I'm going to swap finishes with you, mate, just to...
Everybody will react to drugs in different ways. I gave this girl about 3 times the normal dose of ketamine that I would give an 80-kilogram British soldier. Give her another 20.
Well done, mate.
60 ketamine, so that's quite a lot. She didn't react to a normal way to the ketamine. I just took a bigger dose to get the effect that I needed. Right, Jess, we'll give you another minute. Just let this medicine work, and then what we'll do, I'll just see if I can get this bone back in your leg, okay?
All of us cope pretty well with it. You know, we've got a job to do on scene, and where you would speak to someone who may be standing back and witnessing horrific injuries and horrendous things, we're not standing back and witnessing it, we're doing something with it.
Just gonna try to fix your leg for you, all right?
Are you ready with that, mate?
Put your head back. That's it. You just
Okay.
Jess, slow down. That's it, good lass.
We're so focused on the job, I don't think there's time when your mind's working that way for emotion.
Take some nice deep breaths.
It's actually still offended, isn't it?
Yeah, that'll not reduce. I think we'll have to reduce it in theatre.
We have to know where to draw the line, and sometimes the things that we do don't work as well as we'd like.
How are you doing there, Jess, all right?
Unable to reposition the bone, and with the chance Jess could still lose her foot, getting her to hospital swiftly is vital.
What we're going to do now, okay, we're just going to put you on a stretcher and we'll take you to the helicopter, okay, and we'll fly you into Jimmy Cook's, all right? Told you it was nice medicine I gave you.
I guess all the medical stuff, the jargon, all the activity going on around them isn't anything that they necessarily are interested in. Very often all they want is for someone to tell them it's going to be all right. That's the worst over. You've done really well, Jess. Let Jane know what's happening, mate.
Yeah, mate.
Hey, Des, go ahead.
Yeah, Jane, just an update for you. It's not reducing, so you're going to James Cook. I'll give you full details in about 2 minutes.
Yeah, Roger, thanks. Over.
All right, are we good?
Yeah.
All right, we'll go on 3. 1,
Strong.
2, 3.
Heavy.
Steady on.
Dr. Mike has given Jess a high dose of ketamine. It's not just a painkiller, but a sedative.
I don't even know what's going on. I honestly don't. Lauren, I know that was Lauren laughing. I recognise that laugh, that's Lauren. Anything else, I don't know.
You'll be all right. Have a sleep on the journey.
Yeah, she's out of it.
Thanks, Lauren.
All correct.
Don't leave me on my own.
Hmm?
Don't leave me on my own.
No, I'm with you all the way. I'm your doctor.
Oh, I feel funny, I don't like this experience.
It's all about reassurance and trust, you know. That girl's life and her limb, I suppose, is in my hands, really. So she's got to trust me, and that comes from communication. Okay, Jess, we're just going to take off. You just relax, okay?
It's only a 10-minute flight to James Cook Hospital, but the drugs are already starting to wear off.
Hi Jess, how you doing?
Ketamine's very good, an excellent painkiller, but it does remove you from reality. And once your senses start to come back, you know, you can hallucinate and you can show some quite bizarre behaviour.
Alright, Jess, just in the helicopter, just relax, you're alright. It's okay, just relax. I'm your doctor, I'm Mike, okay? I don't know if you remember, you fell off your horse, remember? You just wait, we're going to be there in 5 minutes, alright, pet?
It is very important that a doctor keeps the patient calm. Thinking of when you travel with children in the car and they all start squabbling and things like that and you're trying to calm them down a bit, I suppose it's a little bit like that. It can distract you.
Jay, you'll have to be just careful on, just on landing if you can do a nice smooth one. Just a little bit jumpy. What are you trying to say? Yeah. Don't do your usual. It's okay, just relax. didn't even feel it. That's a normal one. Minute 2-2.
Right, nice and careful, because she's still in a bit of pain with her leg. Okay.
Hold on. Air desk, go ahead.
Yeah, Jim, we are now clear at James Cook.
Roger, thanks. Go on, James.
All right, ladies and gentlemen. This is Jess. She's 27. She fell off a horse. She's got an open fracture of her tibia and it's displaced out medially. Head to toe, no other injuries, and she's totally stable. I gave her 60 of ketamine to try to reduce it, and to be honest, it doesn't budge at all. In total now, she's had 100 of ketamine, but spread out over about 45 minutes, so she's still a little. She should be quite well in analgesics, but a little bit high.
Yes.
I'm not working yet later on in the week, so if you're still in, I'll check on you.
Okay.
Right, see you later.
Bye.
You're all right?
Well done.
In the south of England, at RAF Benson, it's time to refuel.
Working with Dr. Brown today, who has got a little bit of a sweet tooth. He likes a little bit of sugar in his coffee.
Any kind of junk food he loves. Sweets, chocolates,
anything.
Crisps, anything like that. He doesn't actually eat proper food. I've never actually known him to eat a salad.
For a doctor who weighs like about 10 stone, it's amazing really. I think he gets a bit worried if his blood sugar drops below 25. I think he has to have another wagon wheel.
We're going to have a scientific experiment between the traditional and the jammy to see which people prefer. Not looking, Jerry, are you?
Oh.
You have to tell me.
Blind tasting.
Oh, I have to join you, of course.
Did you ever check your blood sugar?
No, it's fine.
Trust him, he's the doctor. He knows what he's talking about.
That's right. Do as I say, not as I do.
Yeah.
Okay. Okay, on our way. Cheers, mate. Bye.
I'll lock up.
Helinet 24 is called to a paraglider. His chute has apparently collapsed and he's fallen several hundred feet. The patient has not been located, but his injuries are potentially serious. The accident is near Basingstoke, 30 miles from base.
Benson, traffic Helinet 24 Alpha, lifting spot 16 for southbound departure. Just look at the aeronautical chart, John. Yeah.
When we're on a search and rescue type mission, Jerry and Simon would be assisting me in navigating, but also scouring the ground, looking in flight for any other hazards.
Paraglider at 1 o'clock. Yeah, sure. Yeah. Okay, let's keep a really good look at that paraglider over there. Yeah, we've got it. That's the one in the air, is it? Yeah, that's one in the air. Yeah, but it's...
Access-wise, we may be the first resource on scene, depending on how close to the road he is. If he's gone in the woods, I'd expect us to see his canopy, but...
If he has fallen through the trees, we're never going to see him from up here, that's the only problem.
I mean, presumably it's people in the pub who saw him go down.
Yeah, I'm just wondering whether they've seen that guy that we saw flying around who swooped down and then got back up again.
Yeah, exactly.
Yeah. It's starting to feel like a wild goose chase.
We searched for about half an hour and we didn't find anything.
I think we've had a good look. I think we'd call it at this point, don't you?
Roger, thanks for that. We'll resume back to RAF Benson, suspend search.
We'll put that down to a well-meaning member of the public. Yeah. I thought we were going to get the job then. I thought that was going to be the one. Yeah.
That was a couple of grand, wasn't it?
Yeah. How many hours have we been up? That's about an hour.
Yeah, that was
10 minutes, was it?
About an hour. Bang on.
And 200 kilograms of fuel.
Whenever somebody's life is at stake or is on the line, we'll do everything that we possibly can to fully investigate and fully respond to whatever that incident is. But it's an expensive operation. Each mission costs in the region of about £2,500. So yeah, it can be very, very frustrating when we don't find anything.
Although they never found the paraglider, they did find out what happened to him.
The police went along to the pub to have a chat to the people who'd put the 999 call in. When the police arrived at the pub, they noticed a man sitting at the bar with a paraglider in the big bag next to him. And they asked him how long he'd been there, and he said yes, he'd been flying over the pub, and it looked like a nice pub. It was Sunday lunchtime, and so he made a sharp turn, quickly descended to the ground with his parachute in the bag, popped in the pub to order lunch.
Because we don't know what the day is going to hold, and we don't know when we're going to get our next meal, we can become a little bit obsessed about food.
Doesn't look very nice either, does it?
Sausage roll.
Andy looks like butter wouldn't melt, but Andy can actually be a little bit feisty.
Most of the time when I get that bread, the crust splits off the top of it. So I took pictures of it and I sent a complaint. That was weeks ago and they haven't even acknowledged me yet. So I wrote a very polite and very factual letter about this continuing problem with their bread. So as indicated by the cursor, very often you get what I describe as a lateral fault line running across the slice. This is the problem here, Matt. And then it results in... Look at that mess. It's terrible.
Andy's a bit of a joker, but he can be serious when he needs to be.
The incoming call is a suspected heart attack, and the patient needs an urgent transfer to hospital from a remote farm location in Northumberland.
Right. Onto eyes is currently placed 95/50.
Feel a little bit low?
Which is quite low.
Andy and Mike need to decide if it's serious enough to prioritise.
It's critical that we send the helicopter to the patient that needs us most, and the paramedic on the control desk can use their experience and their medical knowledge to make that judgment, to make that decision.
It's a bit of a sort of way of doing it.
Go.
Safe lock secure front then. Lock secure in the rear.
You always worry with a farmer because they're very stoical. They don't admit pain and they don't ask for help. So you know if a farmer is feeling ill or he's asking for help, it's normally something very serious.
Be there in about 10 minutes. There'll be about a 10% chance that the heart might have stopped and we might have to try to get it going again.
With a heart attack, the longer the heart muscle is without oxygen, the worse the prognosis is. So, you know, speed is absolutely vital.
Is that an ambulance at the far end of the far farm? That's it, isn't it? That's the one that's in the red building. Visual. Yeah, just next to that.
The thing with a heart attack is as soon as you put any effort into anything, the pain will get worse because your heart needs more energy, and that's when it'll hurt more. So anything emotional, any kind of movement will all increase the pain. So often these patients they're quite still, they don't want to move around and they're quite calm. Hey, how are you doing, sir? I'm Mike. What happened to you today? Do you feel when you come up, feel short of breath or anything? Yeah. Yeah? You ever had anything like this before when you've been working on the farm or anything? No, nothing at all. Your mum, dad, brothers, anyone like that, did they ever have heart attacks?
My dad died when I was 24. My mother died when I was 27.
Was that through heart problems or? Although he looked fairly well, his heart wasn't very well. His heart trace showed that he'd had a heart attack. We know with a heart attack that his heart can fail or even stop. So it's important to get him to the right place quickly, and that right place is the Freeman Hospital in Newcastle. So just to smooth the process, I phoned just to make sure that everything was arranged. Just looking at this fella's ECG, to me he looks a little bit suspicious. He's got flip T's and he's got ST depression. He's got high blood pressure, and probably most importantly, his mum and his dad both died of heart attacks. Yeah, I think he's definitely had a cardiac event. I'll look at his ECG. So I reckon we could leave here within about 7 or 8 minutes. All right, mate, thanks very much. Cheers, bye. So these gentlemen have done all the hard work, all right? Now, what I've got to do is I've got to take it really serious with you, just because of your parents, you know. Genetics don't lie, all right? What we're going to do is fly you to Newcastle, all right? There's a specialist heart unit there. What they'll do, they'll assess you, okay? If there is actually a little heart attack there, you know, they can do a few things just to reverse that, all right? The thing we've got to do is get you there fast. Any questions about the plan? Right, good man, you'll be fine, all right?
We can get patients to hospital really fast. We're talking 15 minutes as opposed to an hour and a half by road. This gentleman needs to go to the Freeman Road Hospital, which doesn't have its own landing site, so we have to land in a playing field nearby. So I need Andy back at base to organise an ambulance to transfer the patient.
Yeah, it's all copied, call. I'll sort an ambulance out. Paddy Freeman's 15 minutes. Thanks, mate.
We'll reverse away from the wires.
And I've got Mike in the back looking after the patient and looking after any medical emergencies.
Fine, no problem. That's the helipad down there, the field. Affirmative. Yeah, transmitting.
It's my job to fly the aircraft, but I rely on the other guys to help with navigation and also to listen and to look out to keep us clear of any hazards.
There's somebody sat on the seat over in the corner where we're going. Roger. Just these horses as well down in the 12 o'clock. Just gently roll it forward. Yep,
I've not got a great leverage here.
No,
yeah, that's me.
Brian's condition is stable, so Mike's happy for the ambulance paramedic team to take him the short distance to hospital.
Right, Brian. Do you mind if I say goodbye to him?
No.
Right, good luck, Brian. Okay, I'll see you later. You'll be fine, all right?
Cheers, chaps and chappers.
Right.
See you, mate. Hey, Brian.
1 in 10 patients like that will cardiac arrest in the back of the helicopter, so the fact that we've got him here, he's remained stable, is a really, really good sign. When it comes to hearts, brains with strokes, you know, minutes is often crucial, and hopefully it'll make a big difference to his survival.
Okay, back we go.
It's near the end of a 10-hour shift. The crew of Helimed 6-3 are responding to an emergency call.
6-3 are lifting to that job. Well, I wasn't going to bother put my tea on, but I think I will now.
Of course, everyone looks forward to getting home, but we do a serious job, you know, with permanent consequences, really. So if there's a job that looks like it needs to be done, you can ask any doctor in the country, we'll fly to it. At the end of the day, it could be our family lying there who needs help.
They're heading for Gilling West in North Yorkshire, 12 miles southwest of base. A 9-year-old boy has smashed into a wall on a motorbike.
Treating children, it is quite difficult. The children are scared, really scared.
Certainly if there's a job that I have butterflies in my tummy going to, you can guarantee it'll be a job with a young child.
I wonder if you're wearing a helmet. Yeah, I wonder. That's a crucial difference. Oh god, yeah. Between brain and no brain.
These are always the most difficult jobs, you know. Children, obviously there's an emotional aspect which you try to keep detached from.
Right, you're all clear at 12 o'clock. Okay, man.
Oliver, I'm Mike. I'm going to be your doctor, all right? How old are you now?
9.
Now, where's your pain at the moment? Just in your arm. All right. Well, I'm going to leave that till last. I want to just check the rest of you over first, all right? Okie dokie.
Luckily, Oliver was wearing a helmet, but Dr. Mike is concerned he may have hidden injuries.
The secret is not to be distracted by the arm. He's been on a motorbike and he's collided with a wall and he's been ejected over the top of a wall. Okay, so you expect serious injuries. Good lad. If I squeeze the ankles, does that bother you? Looks great. Right, we'll keep you nice and warm. I don't think you've got a flight. We'll have a little look at this arm. All right, good lad. Well, I think you had broken your first bone. Okay. Yeah, I'm a father myself, and actually that helps. Once you're a father or a mother, you learn how to communicate with different ages of children, so you use different speech. And once you get a child's trust, you know, that's part of the battle, really. But what we'll do, we'll put a nice splint on it, and what I'll do is I'll put a little needle in the back of your hand. It's not a big thing. A big, brave boy like you will be fine. And then it just means I can give you some decent painkillers, okay, and make the pain go away. Okay? All right? Come on, you've been so brave so far, okay?
Soldier, you are.
It's
going to make all that pain go
I can get rid of your pain then, it's worth it. If you were my boy, he's exactly your age, called Daniel, I would do this to him, okay? And I'll treat you just like one of my boys. You don't have to look squeeze.
As a paramedic, it is really important to try and stay one step ahead of the doctor so that he has that equipment and he has the drugs, etc., that he needs to deal with the patient.
Nice and still for me, okay? Nice and still, so don't you move, okay? Right. Children, they always cause anxiousness. There's nothing worse than seeing your own child injured. So in a way, it's treating the child. It'll not hurt or anything. It's also treating the parents. You'll be fine though. I'll look after him as if he was my own.
He's worth spotting. He's a good boy.
Oh, well, there you go. So he's a brave soldier.
He's a very good boy.
How's that painkiller? Was that helping you, the one that I gave you?
Yep. Does your arm hurt much now?
It feels better.
Oh, good.
Here we go. Right, well, we'll put it in this splint now.
Blanket over?
Yeah.
Oops.
Come on that.
Ollie, we're pulling you down, okay? Okay, so you're going to get a little helicopter ride, okay? And then we're going to be straight to the hospital with you, okay? All right?
It is hard on parents when we tell them, sorry, we can't take you. But then as a crew, we just try to reassure them that the child's okay and they're in good hands.
So I don't foresee any problems, okay? He has broke his wrist. What we'll do though, when we get him in the hospital, that'll be cleaned up. We'll x-ray it, we'll just see how bad the break is. If the bone has come out the skin, what we'll need to do is take him to theatre tonight and fix that, okay?
Will you use his arm again, or?
Oh, God, yeah. You know, kids, boys are boys, you know? This is what they do, all right? But he'll be fine, okay? And you can totally trust him with me, okay?
Right.
It's another trip to the James Cook Hospital in Middlesbrough. Oliver's mum and dad will drive the 30 miles.
This is something to talk about when you go back after half term.
You excited? I am as well.
You okay?
Hi, it's Great North Air Ambulance Service.
Back at base, Paul's let the hospital know that the team's on their way.
Very nice, It's a lot like a jalfrezi, but it's not. I don't know where it is.
Well then, this is young Oliver. He's 9-year-old. At 1900, he was riding a children's motorbike with a helmet on, and he hit a wall, probably about 2 foot high. He was ejected over the wall. Okay. Injuries-wise, he's got an open fracture of his right wrist. He wasn't knocked out, and his primary survey essentially is totally clear.
Can you look at that doctor there, and this doctor here?
Hmm?
Which is the best looking?
There we go.
Are you right, Oliver? You keep safe, son, all right? Well done. It was an exciting helicopter flight, wasn't it?
He enjoyed it.
Yeah, he loved it.
He said his dad and his brother would be really jealous.
200 miles an hour he was going.
Hey.
Fast. Right then, I'll see you later.
Thank you very much.
Oh, I don't let the dock in.
Oh, come on, admin. Right, it's rock and roll.
Catch the light.
It is a dangerous game, riding a horse, definitely. Yeah, I'm sure one day my little girl will do it, but I'll probably worry every time she does.
I saved his life, basically. Getting him to the hospital, getting him to the Freeman as fast as what they did, so they could get him sorted out straight away.
I'm very lucky to be here, and just, like I say, just take each day as it comes and keep going as long as I can. It's going to be a good few years yet.
Now this is a good day. Yeah, this is what it's all about.
You like to think that you bring something to the party because at the end of the day you are flying the aircraft, but it's a team effort and it's the team that works.
I remember thinking, oh, we'll be home in quarter of an hour, and then the next thing I knew I was underwater and couldn't see anything. It was very black, and you know, I remember thinking, if I don't get out I'm going to drown.
It's the best bit of the day.
So you're very grateful, aren't you?
Yeah.
And when you get to be a big boy, you're going to do lots of fundraising for them, aren't you?
Yes.
As long as it's not a sponsored motorbike ride, we don't mind. Anything else but that.
Can't wrap yourself in cotton wool. What if? Otherwise, you'd never get on a plane and fly away on holiday, and you'd be scared to cross the road. If you're not living on the edge, you're taking up too much room.
Right, shall we work on getting him out and then reassess it?
Yeah. He's under the pedals at the minute.
Let's lift him out as he is on the floor. Put your arm round me. Come on, help me to help you.
This is a 22-year-old who's fallen and has a wooden post sticking out of his eye.
Trauma statistically is the biggest killer of young people, be that on a weekly basis.
Sorry.
Oh, dearie me.
Somebody's going to be looking after you.
Thank you.
We are back with the West Midlands Ambulance Service.
We've got a job.
As the paramedics take us to the heart of the action once more.
He's currently having a seizure in the back of the ambulance.
We're going to be all right. We're going to be all right.
Old friends are back on shift in Dudley.
We see everything from life to death and everything in between.
We do.
And for the very first time,
We're in and we're online.
we're taking you to Stoke,
This is where it's all going to kick off today.
where new crews face fresh challenges
Oh, you kidding me? God, it's going to be horrible.
and experience heart-pounding action.
Grab the kit, grab the kit.
Body-mounted cameras record every moment.
What's that?
Showing you what goes on behind closed doors.
Still struggling quite a bit, aren't you?
Well done, you.
Don't shoot me. I'll try not to.
This is a paramedic's eye view of life on the road as they battle over 4,000 calls each day.
You need to keep very still.
Am I alive?
I think you're alive.
Okay.
You'll be on the front line with them as we take you inside the ambulance.
That's what I love about this job, though. You never know where you're going to go, do you?
No.
Right, is everybody ready? Glasses down.
That's when you mean business, when the glasses are down.
I'm on it today. You are on fire.
Fed up of hearing sirens now.
What else would you be doing on your Monday morning?
What time is it? 12 minutes past 10. Sat at home drinking a cup of tea, watching Jeremy Kyle.
It's a Sunday afternoon in Dudley. Regular crewmates Joe Stevens and Ash Bolus have known each other for nearly 2 years.
I can't get in.
She can.
Ash is a technician and is 4 months away from completing his paramedic training.
Where are your feet?
At the moment, out the door.
Do you have it right the way back?
Yes, I have to. I've got long legs.
Joe qualified 7 months ago.
Right, are you ready? You still can't touch the floor.
They've just been called to their next job.
A 55-year-old male, having difficulty in breathing, fighting for breath, sudden onset, and some chest and upper back pain.
The job has come in as a Category 2, which means there could be a risk to life. The aim is to get to a Cat 2 within 16 minutes. Joe and Ash are there in 8.
That sounds like our patient.
Hello.
Hello.
The patient's wife Usha called 999 when her husband Satnam's chronic cough suddenly worsened.
What's been going on? How long have you had it for? Pop your finger in it.
That's just worse, isn't it?
Okay, there we go. Has he seen a doctor about it?
Yeah, we see the consultant.
Is he on any medication for it?
He's only got this one.
Prednisolone. When was he given that?
2 weeks.
All right.
2 weeks ago. Hello, sir. Is it okay if I have a quick listen to your chest? Yeah. Try and take some nice deep breaths for me if you can.
Is he allergic to anything at all? No. Has he had an episode like this before? Not like this.
So it's been like this for how long? Okay.
That just happened today.
Yeah.
Like out of that. He got the cough for a long time.
For a long time.
This acid reflux.
36.
Before anything else, Joe wants to open up Satnam's airways.
What we're going to do is we're going to pop a mask on. It's a nebuliser, okay? Give you something to try and help with your breathing a little bit, all right? Are you coughing anything up, any phlegm? Yeah. And what colour is it? Red. Okay, okay. So when you're not coughing this hard, are you still producing anything, any phlegm?
It's like watery.
It's watery. Is it clear in colour? Yellow, green? It's clear. Okay. Have you got any heart problems? None at all. Any other medical problems? No. Try and relax for us, okay? I know it's quite scary when you're having difficulty in breathing, all right? But try not to force the coughing out, okay? Have you got any pain at the moment? Okay. Has that pain started with your coughing? Yeah. And does that pain get worse if you take a deep breath in? Stays the same. Let the medicine start working, all right? That's it. How long altogether have you noticed the changes in your phlegm?
In a while.
A while?
Yeah, but it's gone worse now.
The nebulizer should be easing Satnam's cough by now. Joe needs to know more about his condition to decide the best treatment.
Have a spot of blood out your finger, sir. OK, nice and relaxed.
So, when did he start the prednisolone again, sorry? 2 weeks ago. And have you had a recent chest infection?
Because we are consultant, because he went to see the ENT one.
Did they give you any inhalers?
Yeah, but I do travel, it didn't work.
You've not recently travelled anywhere, have you? No? What do you do for work?
Works at Morrison's.
Morrison's. There we go. Nice deep breaths, okay? When you're talking to me, your breathing's a lot better. And the fact that you're able to talk to me in full sentences is a good thing, all right? So we've just got to try and get the anxiety under control a little bit, okay? Unfortunately, the nebuliser therapy wasn't working and Satnam was obviously becoming more distressed. Although we can obviously see that there's a problem, we can't show that to our patient because we're there to reassure them, we're there to make sure that they're going to be okay and get them into hospital on time. Okay? We need to get that investigated further. Try and relax for us a second. We just need to get this trace in your heart, okay? Just have another quick listen. There's quite a lot going on in there.
Crackles or?
Rails, wheezes, crackles.
A lot.
Everything. Would you mind if I tried to pop a needle in your hand? Is that okay? Yeah? It's just in case these don't work, all right, and I have to give you some other medication, okay? Just relax, that's it. Right, there's going to be a sharp scratch, okay? Nice and still for me. Right, when we can, we need you on the chair if that's all right. Okay?
On board the ambulance, Satnam's showing no improvement. The crew decide to give him intravenous steroids, which are stronger and act faster than a nebulizer.
What we're going to do is we're going to give you another medication through a needle in your vein, all right? And hopefully it can start to ease that breathing a little bit more, okay? Because you've had a couple of nebulizers now, and you're still struggling quite a bit, aren't you?
You're doing brilliantly.
Right, just going to pop this through the little needle here, all right? Got to give it slowly over 2 minutes, okay?
Ready? Starting time.
Okay.
Is that Sandwell? Hello, Sandwell. Can we pass you an alert, please? 55-year-old male. Difficulty in breathing. He's having nebulizers back to back. Increasing coughing. He's normally fit and well. GCS of 15. He's cannulated. We're giving hydrocortisone. Perfect, lovely.
How's that feel now? A little bit better.
Happy, Joe?
Yeah. All right. Try and reduce that breathing. We've got another nebulizer I can give you again in a couple of minutes, all right? We're going on blue lights and sirens just so we get you to see a doctor straight away rather than waiting, okay? How's that feeling? Better?
As they arrive, despite the steroids, Satnam's cough is as bad as ever.
I'll probably do a chest x-ray and some blood tests when you get in, all right, and see what's going on. There we go.
Right then, sweet, if you can come and jump off first for me. The problem that we had was the fact that normally when you give salbutamol, you see an effect, don't you?
Yeah. if there was any infections or asthma or things
You'd
like that,
see it,
you'd
wouldn't
see
you?
an improvement, wouldn't
Yeah,
you?
2 weeks of steroids and
it's got
inhalers
worse?
that don't work, and it's got worse.
I hope they get some answers soon.
Mm.
Has your girlfriend got any new horses?
She doesn't have one at the moment.
No.
No. Hers died. He was 27 though, so he was a good age, bless
Is
him.
that the one that tried to kick you?
Yeah, on many occasions.
Does she want another one?
She'd take a horse over me.
Yeah, my best mate and his missus, they sort of track each other and see where they are. Not for, you know, anything dodge, but just to see where they are. And I told my mum about it, and she was like, "Oh, that's not good. That's not good. There's no trust there, is there?
No.
You can't be spying on your other half."
No.
And then both my mum and dad got iPhones and instantly turned the function on and started spying. She was going, "Oh, look, your dad's in Knutsford. He's always bloody there."
In Stoke, ambulance crewmates Joel Mullen
Hi here.
and Nick Griffiths have just begun a 12-hour shift.
These uniforms are not made for hot weather.
We'd rather like polo shirts, wouldn't we?
I think it's the trousers though.
The trousers?
They're so
You'd
thick.
rather just shorts, like postman shorts.
Joel worked on a dairy farm before starting with West Midlands Ambulance Service.
Do you think you could really like pull off shorts with like your boots?
Oh God, yeah. I used to go to school with short black skirts and Doc Martens on.
Did you?
Oh wow.
Amongst other jobs, Nick used to be a swimming teacher.
I had a dream last night. I was back at school actually. That's why.
Did you?
Yeah.
How long ago was that?
Not that long ago. Cheeky.
The pair get details through about their next patient.
So, Mr. Bryan, he's fallen approximately 6 foot from ladder. Patient's fallen onto his back. He had hit his head as well, and he appears confused.
A fall from that height could have caused major injuries.
Oh. 674.
7-4, just to let you know where trauma desk has looked in the case. If you do need anyone else, that's it.
Yeah, roger that. We'll let you know as soon as we get there, thanks.
To get to Brian's house, they have to drive along busy country roads, which present an extra challenge.
He's mounting that there. What? I wouldn't have put my car up there, no, that much. Yeah, good job, thank you.
It takes the crew 15 minutes to get there.
We've got a waiver.
We've got a waiver.
We've got a waiver.
Very helpful for us.
Yeah. That's a nice pink top as
Oh,
well.
he's out in the front here. He's
Is he?
on his back, bless him.
67-year-old Brian was on a stepladder using a hedge trimmer when he fell. His wife and a neighbour have been looking after him till the ambulance arrives.
Hello, Brian.
Hey, sweet.
My name's Joel. What's going on today?
I just fell off them steps, that's all.
What steps are you falling off of? Anyone's there?
Brian's wife Janet was trying to hold the ladder steady for him when he tumbled off.
I saw this part land first.
Right.
And it went on to the wood. And I looked at him and he was out of it and he was going like that.
Okay.
So I thought, I don't like the looks of you. And I'm going, Brian, and he wouldn't answer me. And his eyes were all over the place.
Their neighbour Debbie called for the ambulance.
Janet came over to get me. As I came out of my drive, he wasn't moving. He started to move as I crossed their lawn and I made him lie back down again.
Okay.
So he hasn't moved since.
You haven't moved since? Okay. Have you got any pain at the minute, Brian? That left side?
He's tried to move twice.
Okay.
Tried to keep him still.
Brian, bless him, he got a rickety old ladder on a very uneven surface. It was never going to end well. Sometimes if someone falls awkwardly or lands badly, moving them can be quite dangerous and can actually worsen the initial injury. So keeping them still was the best that it could do for Brian.
When I fell, the ladder's ripped off me and I just hit my side on the side of the ladder, that's all. Like,
Okay.
But
Tell me if you get any peeing anywhere.
Nah, that's all right.
Take a big deep breath for me. Does that hurt? Just this left
Yeah,
side.
you look like that hurt a
You look
bit,
like you're in
to
pain.
be fair.
Can I lift your top up here?
Yeah, but I have rheumatoid arthritis.
Have you?
Right,
You've
where
got
does that
arthritis.
affect your body the most? Everywhere. It's not isolated, you've got it everywhere.
Right, I'm just going to have a little listen to your chest while you're lying there, okay?
Good
Just
work.
relax that arm for me, okay?
Well, you must have something better to do.
No, nothing better to do today. You're the first one of the day today, Brian.
Really?
Yeah, first one. You're the lucky man. How do you feel about just sitting upright for me, just to start with?
Yeah.
Just,
If anything
if I can get
hurts or anything,
hurts at all,
just tell us.
Just tell us, all right? Just bend in the middle, okay?
Okey-doke.
Just bend in the middle for now,
That's fine.
okay?
Yeah.
How you feeling?
Fine.
Right, stay there for me.
Everything okay in your neck?
Yeah.
Yeah,
No
you get a
pain
good
at all.
feeling all the way down the back.
When you take a deep, big breath in, does it hurt more?
A little bit, but it's all right.
Whereabouts is the pain whenever you breathe in? Down that.
You only just say right at the side, that's all.
When we checked over Brian and we were happy that there was no other major concerns regarding his head, neck and spine, we were very aware that when he breathed in, he was getting quite acute pain down his left-hand side. Even though he was trying to hide it from us and make out that he was fine, we could tell by his, just looking at his face, he was in quite a lot of pain. I think it might be worth getting a photo of them ribs.
You think so?
Mm.
You just draw.
You can't really... Can't you just draw him?
Yeah, draw.
Brilliant, I've never heard that before. I love it. Just because if anything has just broken a little bit, we don't want anything protruding on your lung. If it is just a straightforward break, there's not much they can do for it anyway, but it's worth getting a chest x-ray just to have a look that your lungs are all intact and fine. Shall we try the stand?
Well, we go for a stand up, Brian, will we?
Yeah.
You're struggling to bend them.
Where's,
that just age?
is that normal for you?
Okay.
See, this is what's difficult to assess you as well because of your normal pain.
Right.
Might be just worth getting an x-ray.
You're tall, actually.
Yeah.
You're not that tall down there.
I thought that. You must have bigger things to do. I'd be all right.
Brian, will you
don't
be
mind it.
quiet? You're going to be checked because I've seen you.
I aren't arguing with it.
I'm not. I wouldn't argue with her either.
Let's get you on the back of the truck then and then get you comfy and then...
Aye, come and have a seat, Brian.
If anything changes, any pain gets worse or anything, just let us know, okay?
Janet, this lovely seat is for you. Would you like me to take anything for you?
Linky neck.
You can just...
I brought you a clean top, dear, when you had your x-ray.
We all okay?
Yeah, we're all good.
All belted up?
Yeah, I'm getting belted up now. Have you got any pain now that you're sitting there?
It's just
A little bit sore in the left hand side. Yeah.
Though Brian's making light of his accident, Janet was there and saw how hard he fell.
Did you feel me touching your face, Brian? No. I was going, Brian? No. Yeah.
She's beating you up.
Beating you, aye.
Poor Brian here, look at him shaking. It's because you're driving.
When we got there, he was lying. I thought, oh no.
Yeah, it was really rickety pair of ladders,
Yeah.
wasn't it? I said to him on the way in he could do a new set.
And if he'd had the chainsaw as well.
I know. I think he dropped the chainsaw whenever he fell too, so if he'd landed on or something, he was going to be
So
scuppered.
lucky.
Yeah, he could have been a hell of a lot
Hopefully
worse.
it's just a bit of soft tissue damage and he's okay.
Yeah.
I think he was.
There's definitely a better way to come into this
gotta be
place.
a better way
There
to
is. This is not the road that we should have picked.
Oh, we're going down my favourite road.
What, Mincing Lane?
Mincing Lane.
You've got Mincing Lane, you've got Horn Lane, you've got Bell End.
Bell End.
But do you know there's no number 69 Bell End?
Isn't there?
No, there is
Why?
68 and 70.
Oh, yeah, I suppose.
Do you feel like the ambulance is just going to tip over?
Not when I'm behind the wheel of it, no.
It's early evening, And in Dudley, Darren Westwood is on shift with Steph J. The pair are good friends, both in and out of work.
Could be an early meal break, isn't it?
No.
2, 3, 4, no. I'm on, oh God, what shift am I on?
2 twos. See, you're as worse as me. Just as bad as me.
I don't know what's going on.
Harder.
Paramedic Darren has been in the ambulance service for 14 years.
Oh, leave me alone.
Steph qualified as a full paramedic just under a year ago.
I don't think I should have got up today. Hobber.
Their latest call is taking them across town.
Off to Tipton for a male who has had a tremor and been short of breath and had part of his lung removed for cancer. It sounds like quite a major operation.
Chest infection.
Possibly. It might be a chest infection.
To be fair, we don't know when that happened.
2 weeks ago, the lobectomy. So it could be a chest infection, could be post-operative infection.
Yeah.
Oh, he's 83.
83? That's an old guy to have a lobectomy.
Yeah. Oh, we're nearly there.
They soon arrive at their patient Thomas's house. The crew wear body-mounted cameras to record every moment.
There we go, into left, yeah.
Thomas's wife Jean and their 2 daughters are waiting.
Hello, Thomas. Oh, that's better. I can see you now. What's been happening, sweet?
Well, I came in here after my tea and the daughter and the mother was out there and I sat down and I felt a bit cold.
Yeah.
So I just identified a bit, then all of a sudden I started breaking out in shakes.
Mm-hmm.
And I mean shakes, I couldn't keep my legs still.
Just 2 weeks ago, Thomas had surgery to remove half of his right lung, a procedure called a lobectomy.
So where are your scars from the operation? Are they front or back?
On the side.
On the side. Could I have some? Okay. Okay, lovely. You've had no problems with the wound at all? Not been weeping or oozy? Not that you're aware of, no.
38-1. You've got an infection somewhere.
Yeah.
38-1.
A fever is a sign Thomas's body is fighting an infection. This can be very serious, even life-threatening, so soon after surgery.
Have you got much pain at the moment?
It just come on all of a sudden.
Have you had to give that pain a number? So 0 is nothing at all. 10 would be like an operation without an anaesthetic.
Right. Scratch, mate.
I should say around about 7.
About a 7. Okay. Just breathe for me a minute so I can have a listen to your lungs, all right? Sit nice and gentle. You've got a bit of a wheeze on your chest, so we'll give you a nebuliser, see if we can get that under control for you, okay? Yeah. Get you feeling a bit brighter.
Well, this Ventolin, what I'm taking, what they told me at the hospital,
yeah,
it's supposed to be the same thing as a nebuliser.
It is, so that's what we're going to give you now, and it's like 10 puffs of your inhaler all in one go in like a liquid form.
Thomas has obviously had a major surgery, it's called a lobectomy, to remove a lobe due to cancer. He's also got an infection setting, he's wheezing, shortness of breath, and he's actually breathing quite quickly and clammy as well. So this could have been a sign of pneumonia. And if that pneumonia got worse, it could lead to sepsis, which is a quite serious infection for somebody who's as vulnerable as he was.
How's that breathing feeling now?
How's your breathing now, Dad?
The breathing's been all right. I mean, I had breathing problems before I had the operation.
Yeah.
So now I'm going to have more breathing problems, so they told me, because they're having half my lungs.
You'll get, your body will adapt to that.
Yeah, definitely.
It's tight.
Yeah.
But has this medication we're giving you helped with your breathing? Does it feel a bit easier?
Oh, yeah.
Your temperature's only 38.1, so it's not a massive temperature.
Oh, good.
So you're coping with it at the moment.
Right.
So it's going to be a case of up to hospital, course of antibiotics
from
the doctor. We'll nip you up there to see the doctor because I want them to have a look at your wounds and see if we've got to work out where the site of this infection is, whether it's in your chest or whether it's your wound.
Right.
So probably a blood test.
Right.
And then there'll be a course of antibiotics and home again probably tonight. So a couple of hours up there. How does that sound?
Oh, that's better than
Yeah.
stopping here. Okay.
Fingers crossed not stopping him, but I can't promise you not. But as long as you behave yourself, then hopefully we're in and out.
Right.
And if it's in for a night and then out again, then that's not too bad, is it?
No.
Yeah? We just need to keep on top of this infection before it gets on top of you. Yeah?
Yeah.
If you'd done nothing, the infection would have took a hold of your body.
Oh, right.
So you've done the right thing by family calling us. We don't want to worry our patients at any point, but we were glad that Thomas's family did act quite quickly for him. That infection could have got quite serious quite quickly. So who's next of kin for you, Thomas?
My wife, Jean.
Jean. And how long have you and Jean been married?
57 years.
Wow! You said that without moving your lips there.
Right. One seat. Shuffle your bottom all the way to the back of the chair. Relax. How would you like your haircut today, sir?
I'll probably,
Short back inside.
probably will later on.
The one thing I don't want you to do is to help us, okay? So keep your arms in, let us do everything, yeah?
It's raining a bit outside, so...
Yeah. Is that what you... Right.
Love ya.
Yeah, and you.
All right then.
And I'll see you
Get you
later.
back out.
It's a bit windy, eh?
Just a little bit.
With Thomas and wife Jean settled in the ambulance, it's time to get him to A&E.
Right, ready when you are, Wes?
Ready when I am?
Yeah.
I am ready.
Pop a seatbelt on as well. So where did you two meet?
Oh, is it work?
Oh, right.
Right down there.
Okay.
And I'd come out of the Navy.
Oh.
And went there, I was a fitter, and Jane
Yeah.
was working on the line. On the conveyor.
Oh, fabulous.
Yeah.
So was it love at first sight, or did you have to work on you a bit?
Fair sides. Yeah.
Oh, fabulous.
15 minutes later, the crew arrive at hospital.
And we're here.
We are indeed.
The Judge's Hospital. I've been up and down here a few times.
Yeah. Right then, Jean, if we can get you to jump down first. Once the ramp's down, we've had enough mischief tonight.
Just be careful, love.
Here, Thomas's infection will be investigated further.
So he's got the potential of actually being quite a poor chap. He was starting to flag on our sepsis tool, but I didn't want to alarm him and actually say that to him. So kind of quite careful what information I gave him, really.
To be
So
fair
as not
to
to worry
him,
him.
he was actually doing quite well for an 83-year-old bloke who's just had a low
He was
back.
doing fantastic. He did not look 83 at all.
Can't believe it's raining. I've put my washing out. I haven't brought a coat with me. I've got my yellow coat.
I brought mine, or it might fit you like a tent if you want it.
Oh, are you offering your coat to me?
I am.
That's so nice.
And I'll wear my flory jacket, or I just get wet. One of the two. I'm good either way.
At the ambulance hub in Stoke-on-Trent, Joel Mullen is back on shift.
I need to burp.
This time with Sam Smith. They've just finished their dinner break.
Maybe a bit sick, actually. Ate too much.
What did you have in it?
Just pasta.
The pair are on the way to their next job.
It's cardiac chest pain for a 33-year-old female. She's sitting outside in her car.
It's unusual to get a cardiac call for someone so young.
Oh, there we go.
Their patient, Heather, was out for a meal when she suddenly became unwell. Her friends have been waiting with her for the ambulance to arrive.
Right, right. We're here for this lady. Hello. Hey guys.
For a documentary. It's all over my back.
And when did that start?
Not long ago.
Not long ago.
And it's really bad this time. It happened yesterday,
Mm.
but it went.
Can I hold your wrist while you have a chat?
I left it.
Just
'Cause I
relax your
thought
arm
it
for me.
wasn't that bad,
Uh-huh.
and it's gone worse today.
How have you felt on your feet today?
A little bit dizzy and sickness.
Can we get your arm out of this hoodie, actually? Yeah. So does it hurt as you move?
Yeah, it's hurting my arm.
I like that. Is that in case you get annoyed with anybody, is it? Are you sure? There we go. Pop this around your arm, just relax your arm for me. Okay, what type of pain would you say it is? It's like a stabbing pain, like a throbbing pain?
Throbbing pain yesterday, but this one was a stabbing pain today.
Okay, did it take your breath away at all? Or?
It's just I can't breathe.
With the symptoms that Heather was describing to us, like pain in her chest and in her arm, sounded cardiac related. So we wanted to keep her nice and calm, but also get a full 12-lead ECG done, so get her on the back of the ambulance as soon as possible.
Because you're getting these pains in your chest, am I okay to stick some dots across your chest as well? Just have a look at your heart. So 2 just go in the centre and then under your left bust, is that alright?
If we can get to it, yeah.
Stay nice and still. Pretend you're on a beach somewhere with a cold
I'm going
pint.
to Blackpool as it is.
There you go, pretend you're in Blackpool with a cold pint in hand. Right, so just nice and still and quiet, and I'll get this sorted, okay? Right, good. First things first, you're still ticking.
See if you take a big deep breath in, massive deep breath. Does that make the pain worse?
Yeah.
Yeah. See if you push on.
Hey!
Is that sore? Yeah. Okay.
Ouch!
ECG looks normal.
Yeah.
Which is good. Your blood pressure's really good. All your checks actually are within normal ranges. However, you're saying you are getting this central chest pain. If you use, we're taking you to hospital to get you checked.
Okay.
We can give you a spray under your tongue and an aspirin to chew on.
Yes,
See if that
please,
helps.
that'll do. Just do it till I get there.
Do it till you get there.
Yeah.
Might help. What are you doing up here?
Yeah.
Panasia.
All you can eat.
Was it any good?
Yes. You should go.
I'm not surprised you got chest pain after
should go.
going in there and eating loads.
No, I was fine before I got there.
Yeah, see?
Now, did you ever get indigestion before?
Yeah.
Does it feel like indigestion pain? It does feel like indigestion pain.
Is the pain starting and going up a bit as well?
It's going over my back mainly.
Okay.
Over my back shoulder.
Does it feel like, as you take a breath in, it almost catches on your shoulder? As if someone jabs you in your shoulder just as you... Ooh,
Yeah.
You can feel it catching. Yeah, sounds like indigestion.
Like anybody who's gone to an all you can eat Chinese, for me anyway, you get stuck in. And to have a bit of indigestion is probably about fair play.
Yeah.
However, because she'd said she'd had a bit of the chest pain the day before, and she was still getting this stabbing pain to the centre of her chest, it's not worth just ruling it out, so we'd rather err on the side of caution. So we give her a bit of pain relief for cardiac symptoms, because if it isn't that, then all it will do is just help with the pain anyway.
Have you ever had one of these sprays before under your tongue?
That's the first time.
What it does is it dilates all your blood vessels. It might give you a bit of a banging headache.
Okay.
Okay, but it does wear off relatively fast. That's it, close your mouth. Right. 2 halves of a tablet, which I broke by accident. There you go.
I've noticed that.
Sit and chew on them.
Okay. Love yous. See you soon.
Always are.
Heather's friend Matthew is coming with her to hospital, where she hopes her partner Mark will join them.
Are you engaged then?
Yeah.
Oh, congratulations. When's your big day?
I don't know yet. We've been engaged for about a month.
Do you think he's the chap for you?
Yeah, he's always there for me. Head night will be Blackpool for me.
Blackpool.
And I'll go to the Gaties because I sing.
You're what, sorry?
I sing.
You sing?
Yeah.
What do you sing? What kind of music do you sing?
All sorts. Stand by your man.
So you're a bit of a power ballad girl?
Yeah, I'm more power ballads than anything else.
Stay With Me by Sam Smith.
Shut up!
Stay With Me by Sam Smith.
Do you know?
I do know that actually.
Because that's Sam's second name, Heather.
Sam Smith.
Seriously?
I think you should, Heather. I think you should sing it to him.
No.
I'll join in if you want.
No.
With Heather distracted from her chest pain, she arrives at hospital in good spirits.
Right.
Well, I'm giving you 10 out of 10 because you're
10
so
out of
helpful.
10.
You are so helpful. Both of you are.
You don't want to give us 10 out of 10, otherwise we'll start getting big-headed.
No, you are 10 out of 10.
Why didn't you let her sing to you?
Because if someone sings to me better than I can sing, I get embarrassed.
Oh, yeah. But as Sam Smith, you'll
Exactly.
I highly doubt there's many people that can sing better than you. So yeah, you should have let her sing to you. Should have let her sing to you.
In Dudley, Laura Hickman and Vicky Brown are just starting their shift.
So, how big's this steak I owe you for tomorrow then?